I'm Dr. Nirav Goyal. I'm head of liver transplant and HPV surgery at Indraprastha Apollo Hospital, New Delhi. I'll be talking on hepatitis, which is a scourge which is there present in our society. And this hepatitis may occur from several reasons. And I will take you through the reasons for hepatitis, how to manage it, how to deal with it, and what are the cures and curative treatments available. So, prevention of hepatitis. Now, most important prevention strategies are universal access to childhood vaccination for hepatitis B, which is very, very important. Improved hygiene and practices in an out of healthcare setting, and the screening for these viral infections. Now, the effective vaccines are now available for hepatitis A and hepatitis B, and the vaccine for HBV also protects against hepatitis D virus. And since HDV only affects the populations already infected with hepatitis B viral infection. So vaccination, the universal vaccination in childhood is showing very good results in containing the numbers of HBV infection. It has led to actually decline in the numbers of HBV carriers, as well as liver cancers, which are primary liver cancers, which occur in these set of patients. Vaccination is helping to reduce mother-to-child transmission, principal transmission for hepatitis B virus. And awareness and vaccination programs are also part of reducing the spread among adults, especially at-risk groups. Proper hygiene is an important prevention method for all types of viral hepatitis, and this includes clean drinking water and food hygiene, hygienic food handling, proper hand washing, safe sex, injection drug users not sharing needles and needle exchange programs, and in the healthcare settings, fundamentals infection control measures, aseptic techniques, no reuse of needles and syringes, and safe injection practices. And for the screening of the people at risk population and blood products is helping to reduce the spread of hepatitis. As I said, before 92 or 93, all the blood products were not tested for hepatitis C, and now all this scenario has changed. And treatment for various types of hepatitis, depending on the type of hepatitis viral infections one encounters, the treatment will vary. For hepatitis A, it usually resolves on its own. You just have to give symptomatic relief to the patient, and treatment of symptoms include rest and elimination of alcohol. One cannot have any other precipitating injurious element towards the liver, especially alcohol. For hepatitis B, acute hepatitis B infection is not usually treated in immunocompetent adults, as it should resolve naturally. Current treatments for chronic hepatitis B include pegylated interferon alpha, nucleotides analogs. Liver transplant can be considered for decompensated cirrhosis. As I said, they have to be on nucleotides for a very long time post-transplant. And therapeutic monitoring recommended at the end of treatment and at period after the end of treatment, so that one does not miss a resurgence of hepatitis B viral infection. So for hepatitis D, there is no specific treatment for acute hepatitis D viral infection. Again, symptomatic treatment basically treatment directed at hepatitis B virus. Then for hepatitis E, generally no specific treatment for acute HEV, although treatment with ribavirin may be considered effective. For immunocompromised patients, immunosuppressive treatment may be lowered. Otherwise, the treatment is usually focused on relieving symptoms, signs and symptoms. Now, they've been a very often asked question is what is the herbal management of hepatitis? Though I'm not a Ayurvedic doctor, but the general knowledge is that the medicinal plants and natural products have many applications in the treatment of viral diseases due to much lower side effects, and different types of hepatitis, especially hepatitis B, are of the viral diseases whose treatment using herbal medicines is currently of great interest to the limited availability of effective treatment and chemical drugs, and having numerous side effects. Now, there are several plants for the treatment of viral diseases, including hepatitis B, which prevent or decrease the infection via various mechanisms. But good extensive trials have to be done in order to be sure of these drugs.